My topic for this research paper is resuscitation in the pregnant patient. Specifically discussed what's called Perimortem Cesarean section, which is a technique that the fetus is removed from a mother that has gone into cardiac arrest, whether it be through trauma or some secondary illness. The AHA cites that there are several occasions where during a cardiac arrest event the fetus is removed from the mother, and due to that removal and the change in demand of perfusion of the fetus, that the mother had an immediate return of spontaneous circulation and survived the cardiac arrest, but the fetus did not. There are several cases where both the mother and the fetus survived, and it is due, per the physicians, because the demand of perfusion of the fetus, that once it was removed, that up to 1,000 milliliters of blood that is circulating through the uterus was returned to the mother, and that aided in her survival. There are also several cases where the mother sustained injuries that were unsurvivable, and the only way to save the fetus was to perform a perimortem cesarean section. So then comes the question of, at what point in time does this need to occur, and at what gestational age is the fetus considered viable? Well, the American Heart Association recommends that the emergency cesarean section be performed within 4 minutes of the onset of cardiac arrest in the mother. This increases the chance of the fetus surviving and the mother surviving. The theory behind that is that complete separation between the fetus and the mother will occur at about 5 minutes, and this is well within the range of the 6-minute time frame that there's concern of neurological injury or death, brain death, from lack of perfusion to the brain of the mother. So theoretically, this increases the chance of both the mother surviving the cardiac event and the fetus surviving. However, there are many cases, not many studies, but there are many cases that are documented where the mother wasn't going to survive anyway, and CPR was performed, and the fetus was able to be saved due to the CPR that was being performed. I have, throughout my career in firefighting, I have 2 particular cases. One was a 22-year-old with a gunshot wound to the head, 29 weeks gestation, with a transport time to the ER at about 40 minutes, where upon arrival, throughout that 40 minutes, continuous CPR was performed. The physician determined that the fetus needed to be removed, a perimortem cesarean section was performed, and the fetus survived, although the fetus does still have some developmental issues. The second one was a motor vehicle accident where the patient was injured, was alive, and arrived on scene. En route to the hospital, after sustaining severe head trauma and chest trauma, the mother succumbed to her injuries and went into cardiac arrest. CPR was immediately initiated. From that point, transport time was about 10 minutes. Upon arrival at the hospital, the physician made the determination that the mother wasn't going to survive due to her injuries anyway, and that perimortem cesarean section was performed, and the fetus did survive, and to this day is, in all intents and purposes, a healthy young child. The question is what is the time frame? Do we wait and continue to do CPR for 20 minutes, 30 minutes, until we see if the mother's circulation is going to return? Or do you immediately consider emergency cesarean section? In my opinion, you do everything you can to save both the mother and the fetus. And whatever that choice is, that's the choice that you make.